Good morning. I am Dr. Kiran Kumar Lingutla, consultant orthopedic spine surgeon from Yashoda Hospitals, Somajigoda, Hyderabad. I met Mr. Andrew Sakala, who is a retired Air Force pilot from Zambia. This pleasant gentleman underwent two unsuccessful failed surgeries back in his hometown and was finding it very difficult to mobilize even a few hundred feet. On his arrival here, we took a comprehensive history and investigations were done. Subsequently, it was noted that he had a failed back surgery syndrome and he also had an infected discitis as well in presence of failed implants. This was contributing to his decreased quality of life, and his day-to-day activities were quite restricted. I discussed his investigation films with him and suggested that we need to have a two-stage approach to kind of help with his symptoms. So I undertook surgery after thorough counseling. Initially, I planned to explant all the previous failed implants in his back and put new implants in and extended the levels of fixation as well. Then subsequently, after giving two different type of antibiotics intravenously, after a couple of weeks, I went ahead and did an anterior approach, trans-abdominal, that is a retroperitoneal approach, and used an iliac crest bone graft from his right iliac crest and fixed his lumbar spine as well. This was used as a strut graft to achieve anterior stability. So in essence, he had a 360 degrees fusion, following which he recovered quite well. He's afebrile and he's currently on IV antibiotics as well for a course of 6 weeks. Today he is able to walk without any support, and he's quite happy with the outcome of the surgery, and he would like to express his gratitude following this surgery at Yashoda Hospital, Somajigoda, Hyderabad. So these are the radiographs of Mr. Sakala, anterior AP view, which shows failure of the implants. The screw have actually cut through the bone as well. And on the lateral view, we have noticed that the whole of the system has failed and the screws have backed out. And on his MRI scan, he had evidence of disc space infection here, causing his instability as well. So this is the final radiograph following his surgeries, following his 360 degree fusion. As you can note that we've extended the levels of fixation and had to cement a few screws to achieve a solid diffusion mass. On the lateral aspect, I have taken the iliac crest bone graft and impacted into the interbody space between L3 and L4. You can see the graft there. So on the whole, we have quite adequate alignment and you can see him walking without much difficulty now after the surgery. Thank you. Mr. Andrew Sakala, please.
My name is Lieutenant General Andrew Collins Sakala from Zambia. I used to work for Zambia Air Force. The problem which brought me here is the failure on my back, on my spine. This happened in 2015, around December, when I had a backache. Then I went to the hospital. They discovered that two of the discs on my spine had fallen. Then in May 2016, they did an operation on my back, on the spine. Unfortunately, it did not stay long. It just saw me walk up to October 2016. In December 2017, they did another operation on my back, to be specific, on the spine, which saw me recover slightly, and I went home on the 1st of January 2018. From that time, I never walked. I could walk for a distance of 5 meters, but I would be so tired. Most of the times, I would be in bed sleeping. My wife went round and asked a few friends here and there, and of course on the online internet as well. They discovered that the best place they could do this surgery was here in India at the Yashoda hospitals. So she went through finding more details. Finally, we came here at the Yashoda. Upon arrival, I was admitted. They started carrying out various investigations on my body to determine what could have caused the failure on my spine for twice. Those were thorough investigations which took almost the entire week. However, subsequent days, an operation was arranged. So they did the operation at the back and removed the implants. At the same time, they carried out other tests to ensure that there were no bacteria to fill the new implants that put there. It was done in a very short period of time, making me feel that I hadn't any pain, and it didn't take long. I started walking. A thing I could not believe, that I can walk without any problem, have no pain and whatsoever. Otherwise, generally I'm fit compared to the time I came here. I'm very thankful to the doctors who worked on me, particularly the lead doctor, Dr. Kiran Ngutla, and his staff, and in general, Shoda Hospital staff. Thanks so much.